I'm here to talk a bit about the cuts in health and social services with everyone. And as mentioned, they can be somewhat daunting, but I wanted to go through them somewhat systematically. Just going through all of them could take hours, and I urge you to look at the governor's website and look at the 32-page document just categorizing all of them. So to put this in perspective, as Jean mentioned, Health and Human Services proposed budget is about 25% of the overall budget, and it is the lowest amount in terms of proportion of the state budget that we've seen since probably close to the enactment of Medicaid and implementation of Medicaid in the state. So it's much lower as a proportion of the overall budget than we're used to seeing. Also, more than half of the cuts are in HHS programs, as mentioned before. And it's always important to keep in mind when you're thinking about Medicaid and healthy families, or Medi-Cal and healthy families, is that much of this money is due to federal match. So every time we cut $1 from the Medicaid budget, we're actually only saving 50 cents on the dollar, or roughly that, because the other half is coming from the federal government. That's not exactly the case in healthy families because we're kind of block granted. The money is capped coming from the federal government, but still it's not a dollar for dollar savings every time you cut a piece out of Medicaid. The proposed cuts to Medi-Cal and healthy families are fairly numerous, but I wanted to keep in mind that Governor Brown's kind of dealing with a challenging situation in that the federal health care reform law, the Patient Protection and Affordable Care Act, has certain maintenance of effort requirements and federal requirements around not only the fact that there are certain required benefits to receive Medicaid match, but also that the states are prohibited due to the passage of healthcare reform from cutting eligibility levels from what it was on March 23rd, 2010 when the bill was signed into law. And so the reason why you see a lot of this cutting around the edges in terms of optional benefit package, in terms of cost sharing, co-payments, premiums, caps on visits, prescription drugs, and things like that is because the easy way to solve this is cut eligibility to Medicaid, but federal law prohibits the state from doing that, and so they're trying to get a bit creative within the guidance of federal regulation. However, that doesn't mean that the state won't attempt to make changes like that and then go to the feds, to CMS, and ask for a waiver of some of those federal requirements to continue getting those matching funds, but also change the way in which benefits are offered. So in the past, 6 years, we've seen optional benefits pretty much cut down to the bone in terms of dental services no longer being available for adults on Medicaid or Medi-Cal. Optometry visits, things like that have already been cut for adults. And so when we think about Medi-Cal, we think about a fairly comprehensive healthcare program. However, it's important to note that a lot of the policies in that law are holdovers from 1965, when medical equipment and pharmaceuticals were not as significant a part of healthcare as they are now. And so prescription drugs and medical equipment are still considered optional benefits under federal law, which is why they're being targeted for cuts, because it won't hurt the state from a federal match perspective and a CMS perspective to make those cuts. So there are medical equipment caps that range from $1,510 for hearing aids over a year-long period, I think $1,600 for durable medical equipment. So there are spending caps put in place by the budget proposal that could potentially impact certain groups of people that would have to then pay out of pocket for services or go get it at a county hospital or county facility that would be spending county dollars instead of Medicaid dollars, which often isn't subject to federal match. This issue of 10 visits per year capped in the office visits for Medi-Cal is coupled with 6 prescription drugs per month in Medi-Cal limits. So currently, if you have Medi-Cal and you have over 6 prescription drugs, you have to get what's called the treatment authorization request. This would just cap the number of drugs you could get per month to 6. And there are many beneficiaries, especially those with chronic illnesses like COPD, diabetes, etc., who use 9, 10 prescriptions per month. And the treatment authorization request wouldn't save them any money at that point. It would be out-of-pocket care, or they'd have to go without, and of course could potentially result in exacerbations of that illness, and it ends up in a far more expensive ER visit and inpatient stay than a few prescription drugs and the cost related to that. Also, the governor is proposing cost sharing, co-payments, and premiums in both healthy families and in Medi-Cal. moving from $1 for an office visit as a voluntary copayment or $5 voluntary copayment in ERs as it currently stands to a mandatory copayment where it would be $5 per office visit, $50 per ER, and up to $200 for a hospital stay. So they would be passing a lot of cost on to people who make oftentimes under 100% of federal poverty level, and that would affect quite a few adults, especially those with chronic illnesses who have qualified for Medi-Cal due to being aged, blind, or disabled.